σε αυτή την πρώτη σημαντική ενότητα με τίτλο «Η καινοτομία ως καταλύτης για οικονομική ανάπτυξη και καλύτερα αποτελέσματα στον κλάδο της υγείας». Θα καλέσω στο βήμα τους ομιλητές, πρώτα απ' όλα τον κύριο Χρήστο Δήμα, Υφυπουργό Ανάπτυξης, αρμόδιο για θέματα καινοτομίας και έρευνας. Κύριε Δήμα, θα έρθετε να μιλήσετε από το πόντιουμ, αλλά προς το παρόν πάρτε θέση εδώ. Τον κύριο Remo Gujer. Mr. Remo Gujer is Vice President General Manager, Central Eastern Europe, Greece, Turkey, Israel, and India, Bristol Myers Squibb. Mr. Gujer. Mr. Christian Rodseth, he was going to be virtual. He's Managing Director, Janssen, Greece, Poland, and Romania. Mr. Georgiadis Tousimis, μέλος Επιτροπή Φαρμακευτικών Εταιριών, Ελληνοαμερικανικό Εμπορικό Επιμελητήριο, Γενικός Διευθυντής της Amgen Ελλάδας και Κύπρου. And Mr. Oliver Bisazza, he's going to have a video message. He's Director General, Industrial Policy and External Affairs, MedTech Europe. Νομίζω είναι ένα πολύ ενδιαφέρον πάνελ και θα αρχίσουμε αμέσως με τον κύριο Δήμα, γιατί γνωρίζουμε ότι έχει και μια υποχρέωση σε ονομαστική ψηφοφορία στη Βουλή, οπότε θα ξεκινήσουμε μαζί σας, κύριε Υπουργέ, και παρακαλώ σεβαστείτε και τα 6 λεπτά που έχετε στη διάθεση.
Ladies and gentlemen, first of all, I want to thank you. I want to thank the organizers for inviting me to present some initiatives that the Greek government has undertaken in the last years in research and innovation, specifically in the biosciences sector. I have a presentation which I would like to share with all of you. I don't know if it's available. What I do want to say is that the Greek government has a strategic priority to invest in research and innovation, and especially in biosciences. Allow me to say that the structure of the Greek government separates universities that are under the auspices of the Ministry of Education and research centers and companies that invest in R&D that are under the structure of the Ministry of Development and Investments. I will be mostly speaking about the second category. I have some slides where I actually analyze important initiatives that the Greek research community is undertaking currently. I have just pointed some key words because if I have to present them, I will take more than 6 minutes. So we have the Hellenic Pasteur Institute, which has scientists and scientific programs dealing with infections, with autoimmune, neurodegenerative diseases, intelligent systems, neurosciences, multiple sclerosis, and other issues as well. We also have the BACRC Fleming Institute, which has specialities in neurodegenerative diseases, in multiple sclerosis, in analyzing DNA and Alzheimer's diseases. The Foundation for Research and Technology, that's fourth, which is based in Crete. It has competence centers for medical precision, for Alzheimer's diseases, flagship initiatives for national research networking in neurodegenerative diseases, which practically links the academic, the scientific community across the country in these sectors. It has a flagship initiative for the SARS-CoV virus, but also other medical precision centers in the country. Research Center Athena in Athens, which is it has a flagship initiative on a national network for precision medicine and oncology, COVID algorithms, I'm sorry, but I cannot see very well, optimizing drug development, but also using artificial intelligence in many issues. We also have the Biomedical Research Foundation, which belongs to the Academy of Athens. It is creating a genome center Again, it's very important in medicine issues, applying technologies like artificial intelligence, but also other important issues. You might have heard also of Demokritos. Demokritos is the largest research center in Greece. It has important initiatives in the treatment of cancer, especially lung cancer and other issues. It also has the European Digital Innovation Hub on precision medicine, but also drugs in drug screening efforts and drugs institutions in many different categories. We are also trying to fund the research community with the necessary financing tools in order to fuel up and link much more effectively research with innovation. One of our flagship actions is the action Research, Create, Innovate, where in the last years we had more than 180 projects in the specific sector and approximately 130 million for important issues in the biosciences sector. Allow me to say that we have now announced that in January we will have the third cycle of the Research, Create, Innovate action, which intends to even more support, to additionally support financially research centers, universities, academics, and companies that invest in R&D in order to create synergies and products and services that are important and useful for the society. We are also creating innovation clusters. We have 4 innovation clusters that have started to be created in Greece as a result of our financing tools. But apart from innovation clusters, we are also investing a lot in creating competence centers. We know that R&D is extremely important, not only for big companies that have the capacity to invest on their own R&D departments, but also for medium and small companies that do need access to research and innovation, but perhaps do not have the money to invest in it on their own. Apart from that, we are also we are beefing up the startup ecosystem, and allow me to say that up until recently, the Greek government did not know how many startups we had, in which sector they were, how many people they employed. Now we have created a startup registry, Elevate Greece, where we do know our startups, but more importantly, we are capable of implementing tailor-made policies for the startup ecosystem. And I do want to share some of the data with you. And as you can see, the #1 sector of startups in Greece is in life sciences. So we do have an additional incentive to invest more and more in the specific category. Through Elevate Greece, we have had recently created specific policies for angel investors, for stock options, but even for extra liquidity, which is needed in the startup ecosystem. And we are very proud because we have attracted a lot of important companies to become official partners of Elevate Greece, providing the startup ecosystem with useful tools. And many of these companies are from the biotech sector. In this case, you can see the preferred funding sources of the startups in life sciences. You can see that most of them are self-funded. A very large percentage is through grants, and then we have VC funds and angel investors following. We also have the preferred technology that the startups in life sciences apply. And in the first category, you will see we have software. Then we have artificial intelligence, and the other categories follow on. One of our main intentions was to see how we can boost R&D investment in the country. So 1.5 years ago, we did change the tax super deduction rates. We increased them from 130% to 200%. Therefore making Greece one of the most competitive countries in the European Union, actually the most competitive in this specific field. And this has helped boost R&D investment from Greek companies, but also attract important companies from abroad to further invest in R&D. We also believe that providing all of the necessary tools and the necessary framework to our academics is extremely valuable in order to help them create spin-off companies. So 9 months ago, we did change the institutional framework of how spin-off companies in universities and research centers operate. We have simplified the procedure in order to enable talented academics that want to create spin-off companies to start, operate, or even shut down their spin-off company if they want to. Apart from that, though, we are investing also in physical grounds of research and innovation, and we do hope to attract many of the pharma companies in these physical grounds. So one of our flagship initiatives is the creation of an innovation district in Attiki, in Chropi, in Piraeus Street. These physical grounds are places where you have universities, research centers, companies that invest in R&D, startups, and you try to cultivate the necessary conditions in order to create the synergies that are so much needed in order to have innovative products and services. This is an ongoing project, and we hope to have the bidder within the next 3 months. A similar physical ground is created in Thessaloniki as well. The business plan there is partially different. We are trying to attract companies to actually establish their R&D centers within the Thesintech ground and then create an innovation ecosystem around these companies. So that was my brief presentation. It was a bit more than 6 minutes. Sorry, Professor Liargovas. And I have to excuse myself because I have to go to the Parliament. Thank you very much.
We thank a lot the Deputy Minister. And as a researcher, I should note that during the last 3 years, Greece's ranking in terms of innovation and research has been improved considerably. And I think this is also due to the efforts made by Mr. Dimas. Thank you very much. Now we move to our next speaker, distinguished speaker, Mr. Remo Gujer from Bristol. The floor is yours.
Here. Can you hear me? No.
They will arrange.
All right. Thank you very much. It's my great pleasure to be here and go a bit deeper and talk about the opportunities and challenges of the healthcare environment, and of course, with a focus on Greece as well. So my role is a regional role at Bristol Myers Squibb. I cover quite a diverse basket of countries in Eastern Europe, in Turkey, Israel, India as well, and of course Greece. So if you can have my first slide, I wanted to go a little bit deeper and just briefly highlight and talk about what Bristol Myers Squibb is. So we are a global leading biopharmaceutical company, heavily, pardon me? I will go to the microphone. Can you show my slides? That would be great. Yeah, thank you very much. Okay, so you see Bristol Myers Squibb is a global leading biopharmaceutical company with heavily invested in research and development. So we have more than $11 billion annual investment directly in R&D, which is close to 25% of our annual revenues, which is at the top end of the pharmaceutical industry. We have more than 50 molecules in clinical development covering more than 40 disease areas. Pharma innovation has a direct impact in health and wealth of societies. And you see that here when you look at the percentage numbers. These are the mortality decrease rates in cardiovascular disease and cancer, as an example, over the last 10 or 20 years. So these are very, very important numbers. And it's even accelerating over the last years. So when you look at the increase of life expectancy within the European Union or Greece in the middle, these are substantial numbers. And the contribution of medicines to those numbers has continuously increased over the last decades. So in the last 15 or 20 years, pharmaceuticals and medical innovation contributed 73% to the increase of life expectancy, and of course also to the health and wealth of society. As we've seen just from the previous presenter, Mr. Dimas, there's a tremendous amount of innovation around, and also here in Greece. So it's $100 million of annual investment of R&D into the Greek healthcare sector. And there's a potential to grow even further in the coming years to the level of 500 million. So when we have a little bit closer look at the European landscape in the way how medical innovation is accessible, and you see on that chart from the left to right how drugs become available for the first time in average across the different EU member states. And from the bottom up, you see how broad those drugs are available versus their regulatory approved label. You see Greece is positioned very well. And of course, this is a very dynamic chart. So you see Germany in the forefront, but also in Germany it goes up. The breadth of accessibility goes up very quickly after the first access. And you see more at the bottom countries which have more rigid HTA system, and more on the left side we see countries with more multi-step access hurdles and procedures, which obviously then take a little bit longer. So from a health policy side, Greece is positioned very well when it comes to access and uptake of novel innovation. However, when we have a closer look at the pharmaceutical expenditures, we basically see that, and we look here into the hospital sector, we see that the funding that goes into the hospital environment basically hasn't changed over the last 10 years. And with the imposed close budget during the crisis in 2015, it has even lowered by 20%. So we can conclude that today, the health budget which is available in the hospital sector is 20% below the available funds we had 10 years ago. So on the other hand, you see that the contribution from the industry to basically close the gap between the medical needs and the medical consumption in the hospital sector and the effective available budget. So the gap, how this was filled by the industry, continued to increase year over year. And when we look back at the last full year, more than 50% of the pharmaceutical expenses in the hospital environment were funded by the pharmaceutical industry. So that means, in other words, every second pack was given for free. We could also look at the retail sector. It doesn't look much different. The percentage numbers are a little bit lower, but the trends are the same. And it's also important to keep in mind that pharmaceutical prices are cross-referenced around the European member states, and one country has a basket of other countries comparing prices. So overall, the prices in Greece are more at the lower level in the European Union, sometimes at the lowest, and that's before the implementation of the clawbacks and rebates. So for sure, a challenging situation. However, when we look at the more recent developments, and we see them here, how has recent legislative developments evolved in the last couple of months, and what is the perspective the industry currently sees? We basically see there's a further split of health budgets happening. Also, additional clawbacks being implemented or planned for the hospital sector, and with also additional mandatory rebates. And I've illustrated that on the right side in this chart, what it means for a very research-focused organization like ours, also developing medicines in the hospital environment. We've seen a 146% increase of mandatory payments over the last 6 years, or in other terms, a factor of 2.46. And if we just zoom in and look at the year 2022, only this year, the increase is about 46%, which makes it very, very challenging. So let's have a look into the future. What is absolutely crucial, and we heard it from the other presentations already before, a predictability, an environment which creates a sustainable environment for investments is absolutely crucial. When we think about the funding of the healthcare system, we all acknowledge about the crisis which have been over the last years, and we are hanging in there as an organization, as an industry, but we need to catch up from where we are today in the year 2012. And last but not least, there is a vibrant environment. We just heard it from the presenter before. There's a vibrant environment of investments in innovation. So to build on that will be great. And of course, to do more in a joint partnership will be an opportunity for further investments in R&D. Thank you very much. And I pass it on to the next speaker.
Thank you very much, Mr. Gujer. I think you raised a very big issue that has to do with the pharmaceutical expenditure in Greece and the contribution of the public and the private sector. I think this will raise a number of questions later on. Now let's move to the next speaker. He's going to be virtual with us, Christian Rodseth, from the Managing Director, Janssen, Greece, Poland, and Romania. Hello, Mr.
Hi, thank you for having me, and apologies that I'm not able to join you, but I'm currently in Belgium, defending my business case to my leadership. But thank you so much for having me. If you can just confirm once the slides are visible, and then I can get going.
Okay.
So what I'd like to do is just to highlight a little bit about our company and then speak through a few of the challenges that we see in the Greek healthcare system, but then more importantly, to just speak a little bit about how we see being a partner in some of the solutions. So if you go to the next slide, just very briefly who we are as an organization. And essentially what I'm here to tell you is that we're an organization that delivers innovative solutions, innovation that really provides access to patients for therapeutics that they would not have if innovation was not there. And you can see on the following slide what that means a little bit in numbers to us. So if you go into the next slide, you'll see that in the EMEA region, if you want to transfer, there we go, we heavily invested in Europe. We're in 30 countries. We're heavily invested in Greece itself, Malta and Cyprus. Importantly, we've got 7 R&D sites, and we invest over $1.5 billion. So we're investing a tremendous amount of money back into innovation because we believe that that is the lifeblood of our organization, and ultimately the health of society is if we can innovate. And if you go to the next slide, please. I wanted to just focus on 2 facts, and that ultimately is that innovation extends and it saves lives. That is a proven fact, and the previous speaker touched on that lightly. But ultimately, one of the messages that we must understand is that a healthy society is a productive society. And if we're able to support that through pharmaceuticals and medicines, I think that is really something that we need to do. Because if you see that old man in the picture, that's what it's about. That if we're being successful, we're able to allow patients to have meaningful lives and to spend time having a quality of life. If you go to the next slide, I'll touch on where I think there's a real opportunity for us to invest, and that is clearly in healthcare. The public healthcare spend in Greece represents 6% of GDP compared to almost 9% in the average of Europe. And that for me is alarming coming into the healthcare sector recently in Greece, is to realize that we're part of the European Union, but we're not investing in healthcare like we potentially should be. And on the next slide, you'll see that in reality, and it was mentioned by Remo, but essentially patients, their needs for healthcare has clearly advanced since 2014. But unfortunately, the pharmaceutical budget hasn't done that. And I think we're probably starting to get behind in a place that we can't afford to do that. You can see that our budget is significantly below the EU average. The concern is that we've got a real opportunity to rationalize some of the prescribing taking place. And if the sector is working effectively, we should be able to reward innovation, at a point lose the exclusivity, and then allow the generic organizations to do their role, which is vital to increase penetration and further access to medicines. And the alarming thing for me is that 7 out of 10 products are paid by the pharmaceutical companies. So if you ask, are we invested in the Greek patient? Absolutely. But unfortunately, we reached the point where the current budget split is really unsustainable. And it's providing real concern for us, and it's preventing us from doing what we do best. And what we do best is to provide innovation, and innovation that extends and then saves lives. And if the innovative pharmaceutical industry is effective, we'll have a flourishing generic sector as well. Now, I've flagged a few concerns that we have, but I don't want to come here and just share bad news. But ultimately, on the following slide, this is my call to action, and really to say what we need to do, if you can go to the next slide, please, is that we really need to invest in patient health. And what that means is increasing the public contribution to the pharmaceutical expenditure. We need to. It's a glaring issue and a huge opportunity for us to make a greater impact on the productivity of the Greek patient. Importantly, and it was touched on earlier by Natalie and others, is we need to accelerate digital health transformation. We made massive strides through the COVID-19 pandemic, but we really need to accelerate that. I think there's a massive opportunity for us to do that. And then ultimately, it's around implementing structural reform to generate greater efficiency in patient care. Because the more effective we get in using the limited resources we have, we will be more successful in patient care. And if we have this predictability and stability, it will attract even more international investment into healthcare and into the Greek economy. And I'll close on my next slide by really saying that J&J and Janssen, we are really committed to healthcare and to collaboration. There's an African saying, I'm from South Africa originally, it says, if you want to go fast, go alone. If you want to go far, go together. And I think really this is an opportunity for us to, at this crossing point and this real intense moment for innovation, is we can decide, do we walk together or do we walk apart? And I want to encourage you to say, at J&J and at Janssen, we're focused on walking together. And if you go to my final slide, I wanted to just indicate that we will partner with anybody who's willing to create a future where disease is a thing of the past. So thank you for allowing me to share my thoughts, and I'll hand over back to the moderator.
I noticed that you used a lot the words investment and sustainability. I think there will be a couple of questions later on in the second round, but now let's move to the next speaker, Georgios Tousimis, που είναι Γενικός Διευθυντής στην Amgen Ελλάδας και Κύπρου. Κύριε Tousimis.
Καλημέρα σας. Και να ξεκινήσω τη συζήτηση λέγοντας ότι δυστυχώς για άλλη μια φορά την κάνουμε μεταξύ μας. Βρισκόμαστε σε μια αίθουσα και είμαστε όλοι εργαζόμενοι στον κλάδο και δεν υπάρχει, νομίζω, συγγνώμη αν κάνω κάποιο λάθος, εκπρόσωπος της πολιτείας η οποία χαράσει την πολιτική υγείας στην αίθουσα για να γίνει μια σοβαρή συζήτηση επιτέλους. Η παρουσίασή μου ακολουθεί τους προλαλήσαντες, and sorry for doing it in Greek, but I think it's better to do it in my native language since I am in Greece right now. Η συζήτηση, λοιπόν, την οποία καλούμαστε να κάνουμε αφορά το πώς μπορούμε να υποστηρίξουμε την καινοτομία και να φέρουμε τελικά επενδύσεις στην Ελλάδα. Και λαμβάνει η χώρα σε ένα πολύ δύσκολο και κρίσιμο χρονικό σημείο, καθώς ακριβώς αυτές τις ημέρες γίνεται ένας πολύ μεγάλος δημόσιος διάλογος για την αλλαγή του πλαισίου φαρμακευτικής πολιτικής με τέτοιο τρόπο, ο οποίος στοχοποιεί την καινοτομία στη χώρα μας. Πολύ απλά και ωραία. Οι κυβερνήσεις στη χώρα μας τα τελευταία χρόνια, την τελευταία δεκαετία, ιστορικά, είναι γεγονός ότι έχουν χάσει μια πολύ μεγάλη ευκαιρία. Είχαμε μια οικονομική κρίση, την οποία μπορούσαμε να εκμεταλλευτούμε για να βελτιώσουμε το σύστημα υγείας και να βγάλουμε από πάνω μας στρεβλώσεις που είχαν δημιουργηθεί με τα χρόνια. Δεν πήραμε τα μέτρα, δεν ήμασταν τολμηροί για να δούμε τι πρέπει να κάνουμε και να κοιτάξουμε κατάματα το πρόβλημα, να διαχειριστούμε λοιπόν τη δαπάνη όχι ως δαπάνη, αλλά ως συνταγογράφηση όγκων και φαρμάκων που απευθύνονται σε ασθενείς. Αυτό λοιπόν είναι γεγονός και νομίζω ότι το δεχόμαστε όλοι και ο ίδιος Υπουργός στην ομιλία του, στην ανακτήρια ομιλία του, το δέχτηκε και αναφέρθηκε αναλυτικά σε αυτό. Συγχρόνως, δεν προχωρήσαμε σε οποιαδήποτε αύξηση ή, εν πάση περιπτώσει, επαναδιαμόρφωση του επίπεδου χρηματοδότησης της υγείας. Αναφέρθηκε νωρίτερα ότι είμαστε σήμερα ακόμα στα επίπεδα του 2012, τη στιγμή που οι ανάγκες για περισσότερη υγεία παγκοσμίως αυξάνουν συνεχώς. Και βρισκόμαστε ως Ελλάδα πολύ χαμηλότερα από τον ευρωπαϊκό μέσο όρο. Και τέλος, οι ελληνικές κυβερνήσεις, η ελληνική πολιτεία βολεύτηκε γύρω από αυτό που ονομάζεται clawback. Το είπε πολύ απλά και στεγνά, θα έλεγα, είναι μια έτσι λίγο δύσκολη λέξη αυτή που χρησιμοποιώ, ο Υπουργός Υγείας νωρίτερα, γιατί το clawback από μόνο του δεν κινητοποιεί οποιαδήποτε κυβέρνηση στο να πάρει μέτρα, καθώς έτσι κι αλλιώς, στο τέλος της ημέρας, ποιος θα πληρώσει? Η καινοτόμος φάρμακοβιομηχανία. Αυτό που είναι ξεκάθαρο όμως επίσης και αναφέρθηκε έντονα και από τους δύο προηγούμενους ομιλητές είναι ότι η καινοτομία έχει αξία, δεν έχει κόστος. Βρίσκεται εδώ για να βοηθήσει τις ζωές των ανθρώπων και έχει αποδείξει ότι βελτιώνει το προσδόκιμο επιβίωσης με πολλές καινοτόμες και σημαντικές θεραπείες και δεν νομίζω ότι κανείς αμφισβητεί την σημασία που έχουν οι θεραπείες π.χ. για τον HIV ή για τον καρκίνο του μαστού ή για τις καρδιαγγειακές παθήσεις, οι οποίες έχουν βοηθήσει τον πληθυσμό όχι μόνο αυτής της χώρας, αλλά παγκοσμίως να προχωρήσουν μπροστά. Ας μιλήσουμε όμως για επενδύσεις, για καινοτομία και για τα απλά εκείνα πράγματα που χρειάζεται να έχει οποιοσδήποτε μαθητής γυμνασίου, θα έλεγα, βρίσκεται σε μία αίθουσα, για να μπορέσει να προχωρήσει μπροστά. Τρία είναι τα συστατικά της επιτυχίας. Καταρχήν είναι το να υπάρχουν κίνητρα. Να υπάρχουν κίνητρα για να επενδύσεις. Και να το κάνεις αυτό σε ένα περιβάλλον το οποίο είναι από τη μία πλευρά βιώσιμο, και αναφέρθηκε πολύ έντονα το συγκεκριμένο στοιχείο νωρίτερα, και από την άλλη πλευρά προβλέψιμο, έτσι ώστε να μπορεί κανείς να βλέπει μπροστά το μέλλον το οποίο το επιφυλάσσεται. Και γνωρίζουμε όλοι στην αίθουσα αυτή ότι η φαρμακευτική έρευνα και τεχνολογία θέλει χρόνο για να φτάσει από την αρχική της σύλληψη μέχρι τον ασθενή ο οποίος θα υποφεληθεί από αυτήν. Πώς θα πάμε λοιπόν εμείς στην Ελλάδα, πού βρισκόμαστε? Θα τολμούσα να πω ότι στον χώρο των κινήτρων, και είναι κρίμα που δεν είναι εδώ ο κύριος Δήμας, η κυβέρνηση έκανε κάποια πρώτα βήματα που ήταν αρκετά σημαντικά και συνεχίζει να προσπαθεί στην κατεύθυνση αυτή. Πλην όμως, με το πέρασμα του χρόνου, η έμφαση στις κλινικές μελέτες, αυτά που μπορούμε εμείς, σαν καινοτόμος φαρμακοβιομηχανία, να φέρουμε στη χώρα, βαίνει συνεχώς μειούμενη και δεν οδηγεί τελικά στο να έχουμε κινητοποίηση στο να φέρουμε αυτές τις μελέτες στην Ελλάδα. Τώρα, όσον αφορά στο κομμάτι του sustainability και του predictability, νομίζω ότι έχει γίνει πολύ μεγάλη συζήτηση. Δυστυχώς, τα φάρμακα για σοβαρές ασθένειες, από τον ορισμό τους στη χώρα μας, ονομάζονται FIC, φάρμακα υψηλού κόστους. Άρα, εξ ορισμού μιλάμε για φάρμακα που δεν έχουν αξία, έχουν κόστος. Πρέπει να αλλάξει αυτή η νοοτροπία. Εμείς, σε αυτή την αίθουσα που βρισκόμαστε εργαζόμενοι στην καινοτόμο φαρμακοβιομηχανία, έχουμε κάνει μεγάλο λάθος. Δεν έχουμε τοποθετήσει σωστά την αξία της καινοτομίας εκεί έξω και καλούμαστε να το κάνουμε, έστω και τώρα την ίστατη στιγμή. Και έτσι βρισκόμαστε να αντιμετωπίζουμε μία αναδιαμόρφωση του προϋπολογισμού, μία λογική κατάτμισης, η οποία οδηγεί μεγαλύτερες επιστροφές στις καινοτόμες θεραπείες, οι οποίες είναι εκείνες που τελικά αυξάνουν το προσδόκιμο ζωής. Είναι ένα παράδοξο, το οποίο καλούμαστε να διαχειριστούμε όλοι μαζί. Και νομίζω ότι το παράδειγμα του σούπερ μάρκετ είναι πολύ κλασικό. Φανταστείτε έναν καταναλωτή, ο οποίος μπαίνει στον ΑΒ Βασιλόπουλο, και συγγνώμη για την ονομασία της συγκεκριμένη, και ο οποίος μέχρι τον Απρίλιο ψωνίζει ό,τι θέλει και πληρώνει για αυτό. Αλλά μετά τον Απρίλιο συνεχίζει και ψωνίζει ό,τι θέλει μέχρι τον Δεκέμβριο και ο ΑΒ είναι αυτός που πληρώνει τις αγορές του. Σκεφτείτε, αυτή η επιχείρηση θα έμενε στη χώρα αν γινόταν κάτι τέτοιο εσαΐ? Νομίζω ότι η απάντηση είναι προφανής. Είμαστε όμως εδώ, είμαστε κοινωνικά υπεύθυνες εταιρείες και δεν θέλουμε να αφήσουμε τους ασθενείς της χώρας μας να μείνουν χωρίς θεραπεία. Την ίδια στιγμή που οι αλλαγές στο πλαίσιο λειτουργίας μας είναι συνεχής και είναι και τελείως με την αίσθηση της έκπληξης. Έχω την αίσθηση ότι ο Υπουργός χαίρεται όταν ανακοινώνει κάτι με αναδρομική ισχύ, γιατί είναι σαν το παιδικό παιχνίδι. Του χαχά, έπιασα και τώρα θα πληρώσεις. Έχουμε κάνει πολλά λάθη, πρέπει να προχωρήσουμε μπροστά. Η καινοτόμως λοιπόν φάρμακοβιομηχανία ζητάει συγκεκριμένα πράγματα. Ζητά καταρχήν να γίνει αναστολή της κατάτμισης του προϋπολογισμού. Δεν είναι δυνατόν να έχουμε ανισότητες μεταξύ ασθενών σε σχέση με τη θεραπεία που λαμβάνουν. Και, εν πάση περιπτώσει, δεν είναι δυνατόν να λαμβάνονται μέτρα με αναδρομική ισχύ, χωρίς να υπάρχει καμία συζήτηση για τα δεδομένα τα οποία έχουν παράξει αυτές τις αποφάσεις. Συγχρόνως, ζητούμε επισταμένους να αυξηθεί ο προϋπολογισμός για τα σκευάσματά μας, για τα φάρμακα συνολικά, για την υγεία. Καταλαβαίνουμε ότι βρισκόμαστε σε μια δύσκολη χρονική στιγμή, καταλαβαίνουμε ότι υπάρχει μια ενεργειακή κρίση εκεί έξω. Παρ' όλα αυτά, δεν είναι δυνατόν για 10 συναπτά χρόνια ο φαρμακευτικός προϋπολογισμός της χώρας μας να παραμένει σταθερός. Και χαίρομαι εν μέρη για το ότι ο Υπουργός Υγείας ανακοίνωσε νωρίτερα ότι θα υπάρχει μια μικρή αναπροσαρμογή προς τα πάνω το 2023 βάσει του αναμενόμενου growth του ακαθάριστου εγχώριου προϊόντος. Συγχρόνως, ζητούμε πολύ συγκεκριμένα μέτρα και πολύ επισταμένως επιτέλους η πολιτεία να σηκώσει τα μανίκια, να λειτουργήσει ξανά η περίφημη Επιτροπή Παρακολούθησης Φαρμακευτικής Δαπάνης, αλλά με ουσία, με data, όχι απλά για να βρισκόμαστε σε μία αίθουσα και να συζητάμε μεταξύ μας, γιατί δεδομένα υπάρχουν. Η Ελλάδα είναι πολύ πλούσια σε παρουσία δεδομένων και μπορεί να τα αξιοποιήσει αν θέλει. Έχω την αίσθηση δυστυχώς ότι δεν το θέλει όμως. Και με δεδομένο το ότι υπάρχουν τα δεδομένα, επιτέλους να προχωρήσουμε στην προτεραιοποίηση του ελέγχου των όγκων. Το ανέφερε νωρίτερα ο Υπουργός ότι θα προχωρήσουν σε μία έτσι αξιολόγηση των θεραπευτικών πρωτοκόλων στις 10 μεγαλύτερες κατηγορίες κόστους στη χώρα τους επόμενους μήνες. Ναι, αλλά η κυβέρνηση αυτή βρίσκεται στην εξουσία εδώ και 3 χρόνια. Νομίζω ότι θα μπορούσε να έχει κάνει πράγματα πολύ περισσότερα το προηγούμενο χρονικό διάστημα. Και αυτό ισχύει και για κάθε κυβέρνηση προφανώς, έτσι και για την προηγούμενη αυτή που έχουμε σήμερα. Και τέλος, να είναι πιο αυστηρή η πολιτεία στην εφαρμογή των μέτρων τα οποία θέλει να εφαρμόσει. Γιατί ως γνωστόν, η λεπτομέρεια ο διάβολος βρίσκεται στη λεπτομέρεια και πρέπει να είμαστε σίγουροι ότι τα μέτρα που εφαρμόζουμε οδηγούν τελικά στο καλύτερο δυνατό αποτέλεσμα. Στο τέλος της ημέρας, το ζητούμενο είναι να σκεφτούμε τον ασθενή. Να κάνουμε αυτό που είναι καλύτερο για εκείνον τον ογκολογικό ασθενή, ο οποίος χρειάζεται τη θεραπεία την οποία φέρνουμε, και αυτή που έχει στα χέρια του σήμερα, αλλά και αυτή που θα μπορούσε να έχει στα χέρια του αύριο στη χώρα μας με τις προσπάθειες που κάνει η φαρμακευτική καινοτομία. Ευχαριστώ πολύ.
Ευχαριστούμε πολύ τον κύριο Tousimis. Νομίζω ότι χτύπησε καμπανάκι, για να μην πω καμπάνα, για την βιωσιμότητα γενικώς της βιομηχανίας που βρίσκεται στην Ελλάδα και εξυπηρετεί τον τομέα και το συνδύασε και με τα κίνητρα. Πράγματι, η κινητροδότηση της οικονομίας μας είναι όχι μονάχα στο φαρμακευτικό τομέα, αλλά παντού πρέπει να είναι παρούσα. Να πάμε τώρα στον επόμενο τελευταίο ομιλητή, εξίσου σημαντικό, θα είναι video message, τον κύριο Oliver Bisazza, Director General, Industrial Policies and External Affairs, MedTech Europe.
Good afternoon, ladies and gentlemen. Thank you to the organizers for the kind invitation to speak with you today about the role of innovation as a catalyst for economic growth and better health outcomes. My message to you today is on behalf of the medical technology industry, which is an industry that continually strives to deliver improved patient outcomes, better tools for healthcare professionals, and greater health efficiencies overall. And the main way we do this is via constant technological innovation. When we talk about innovation, some understandably tend to worry first and foremost about the costs. My invitation for you today is to look at medical technology innovation not as a cost, but as an investment. An investment is all about dedicating resources today so that we enjoy greater returns and greater value into the future. And healthcare systems today, whether in Greece or anywhere else in Europe, need solutions and value for the future. We all know our populations in Europe are aging. We know that burdensome non-communicable diseases are on the rise. And we also know that the COVID-19 pandemic took a terrible toll on the ability of our hospital staff and on the capacities of our diagnostic testing laboratories. Keeping up with all this and getting healthcare to where we need it to be will inevitably come with costs. But what our healthcare systems need most is investments in the right places. Investments that can create savings and efficiencies elsewhere in the system, be it elsewhere in the healthcare system or elsewhere into the economy. Investments in medical technology to meet the challenges of today and of the future. Let's look, for instance, not only at the per product price tag of a medical device or of a diagnostic test. Let's look also at the human and financial value of helping our fellow citizens avoid sickness. The value of detecting illness when it does happen early enough so that we avoid hospitalization. Let's look at the value of keeping patients out of hospital altogether one day. And if there are still cases where hospitalization must happen, let's look at the enormous value of getting patients discharged earlier so that their recovery can finish in a home care environment rather than in a hospital bed where they need the attention of our precious hospital staff. Medical technology innovations offer all of this kind of value, whether it's innovation in remote patient monitoring solutions, innovation in minimally invasive surgery techniques, innovation in automated drug management, innovation in the best-in-class diagnostics, and so on. Value for medical technology investment. One recent study I saw in the Netherlands estimates that if medical technology is used properly, it has the potential to free up more than 100,000 healthcare workers in that country. 100,000 healthcare workers. That's more than the total Dutch healthcare worker shortage, which is expected for the year 2031, for hospital care and elderly care combined. Similar opportunities exist in other European countries, including Greece. However, if we really want to leverage these benefits of medical technology innovation, a few things are required. First, we have to be honest in recognizing that changes in our healthcare systems still happen far too slowly. We must look really hard at the current state of our healthcare systems and the demographic trends which are clear in Europe, and recognize the urgency of what is coming if we do not move faster. We must also play our part as the medical technology industry to help policymakers, hospitals, and patients better understand the constant changes we are making to medical technology so that the value of our innovation is recognized for what it is. We need also to help our procurement partners see beyond the simple price tag of an individual healthcare product and instead embrace true value-based healthcare and its many financial incentives across the full patient pathway. And finally, we do need these changes to happen across the system. In my line of work, I always hear about courageous efforts to better leverage the benefits of medical technology innovation, but these are often at the level of individual country or individual hospital pilots. In the interest of health equality for all our citizens, these courageous efforts must start being attempted at the level of entire healthcare systems, and then we will see their benefits for what they are. This is our call to the wider healthcare community across Europe. The opportunities are there for those with the will to seize them. My invitation to all of you is to help Greece to be a trend setter, a country that can reap the rewards of medical technology innovation and set an example for the rest of Europe. Ladies and gentlemen, thank you for your intention. I wish you a very fruitful rest of the conference. Thank you.
I think μπορούμε να συνεχίσουμε από εδώ. Can we continue from here? Okay. Okay, now it's I think the most interesting part of this panel. We have 15 minutes for questions. There are a number of questions. I will choose some, and we'll start with a question to Mr. Gujer first. Mr. Gujer, you delineated the spectrum of the necessary steps to foster a predictable and innovation-friendly investment environment in Greece. Given that all the stakeholders agree on the structural reforms that should be applied and accelerated in medium term, what are the short-term steps that should be taken in this regard according to your perspective?
Yeah, thank you very much, and I hope you can hear me. Mm-hmm. So just listening to the other presenters this morning, I think it starts with a mindset. First of all, innovation is not just a cost center that is created for the healthcare system, but basically it's the solution towards a better, healthier environment. And I think this is we have to start with the mindset. Mm-hmm. We have to really rediscuss what is the cycle of innovation that needs to be nurtured further. And there is a life cycle of drugs which is turning slowly but continuously. And when drugs lose their exclusivity, their patent, they can be genericized. And usually that's a moment where funds will be freed up and will be available for new innovation. And when we look at the healthcare environment here in Greece, we have, in average, compared to other European member states, the highest prices and the highest investments in relation to the total healthcare spendings and pharmaceutical spendings for genericized drugs. So there's a lot of funds which currently is not harnessed in order to invest into innovation. So it's really a mindset change to understand what is the value innovation can bring. In the same way, we can think about what is the theme of the conference you hear. What brings us together in this room? It's the innovation. And if we believe it's not just incremental innovation, when we believe it's a revolutionary innovation, because we talk about the fourth revolution, a revolution doesn't happen just like this. It happens with a fundamental mindset shift, which then brings along a structural change as well from a health policy point of view.
Thank you very much. Thank you. Okay, now I have a question for Mr. Rodseth. I don't know if you can listen to us. Mr. Rodseth?
Yes, I can hear you.
Is he around?
Yes, I am here.
Okay, we can, in the meantime, we can move to Mr. Tousimis.
I can hear you clearly.
Θα το πω στα ελληνικά. Η ερώτηση είναι ποιος ο ρόλος της τεχνολογίας και των real world data στη βιωσιμότητα του συστήματος υγείας. Τώρα, ναι.
Αναφερθήκαμε νωρίτερα στις ομιλίες των συνομιλητών ότι τα δεδομένα παίζουν πολύ σημαντικό ρόλο στο να καταλάβουμε και να κατανοήσουμε τις αιτίες, τους λόγους για τους οποίους ένα σύστημα υγείας είναι λειτουργικό ή όχι. Έχουμε μαζί μας και την κυρία Γκάγκα από το Υπουργείο Υγείας, που ξέρω ότι κάνετε μια πολύ σημαντική δουλειά στον χώρο των νοσοκομείων για να κατανοήσουμε καλύτερα τη λειτουργία τους και την αποτελεσματικότητά τους. Το ίδιο ακριβώς πρέπει και μπορούμε να κάνουμε και στον χώρο του φαρμάκου, με την χρήση των real-world data που είναι διαθέσιμα. Η Ελλάδα έχουμε την τύχη να έχει ένα πολύ μεγάλο εύρος διαθέσιμων δεδομένων μέσω της τηλεοπτικής συνταγογράφησης και όχι μόνο, τα οποία δυστυχώς δεν εκμεταλλεύεται στο βαθμό που θα μπορούσε, για να πάρει από τη μία πλευρά αποφάσεις χάραξης στρατηγικής για την υγεία και από την άλλη πλευρά για να δει σε ποιες θεραπευτικές περιοχές χρειάζεται να γίνουν περαιτέρω παρεμβάσεις για να βελτιωθεί η ζωή των ασθενών. Έχουμε λοιπόν μια ευκαιρία. Το παράδειγμα από τις άλλες χώρες εκτός Ελλάδος αλλά εντός Ευρώπης είναι πολύ ισχυρό. Ας δούμε λίγο τι γίνεται στη Σκανδιναβία, που πραγματικά υπάρχει μια επανάσταση χρήσης των δεδομένων από την πραγματική ζωή των ασθενών. Και ας προχωρήσουμε μπροστά. Δεν είναι δύσκολο. Πολιτική βούληση χρειάζεται.
Μάλιστα. Ευχαριστούμε πολύ. I don't know if Mr. Rodseth is with us. Otherwise, we can move to another question.
I can hear you.
Oh, okay, great. Mr. Rodseth, we have a question for you. Which do you consider the enablers towards a more sustainable healthcare environment?
Thank you for the question. The most important thing is collaboration of all stakeholders. And when I say all, I mean we need to be able to put government authorities together, policymakers, the innovative pharmaceutical industry, as well as the generic pharmaceutical industry, and to talk about the collective problems that we see and how to address that. Because if we're not unified on what we want to do, and that should be to improve healthcare for Greek patients, I think we're going to struggle to go forward. I think that there's an opportunity for us to stop pointing fingers, but to start pointing a finger at the problem and to solve that together. The other thing that I think will make a significant difference is digital health and transforming to that a lot quicker. I think there's a lot of inefficiencies currently in a lot of healthcare systems, and Greece is not unique to that. So I believe that if we can work together, accelerate digital health, we can streamline and improve a lot of the inefficiencies, and ultimately focus on what's the most important, and that is to ensure that Greek patients get EU-type healthcare and access to quality products.
Okay, thank you. Since you are with us to make sure that you continue, I have a second question for you. Based on your experience in a global position of a multinational company like J&J, what would be the key points for deciding to invest more in Greece?
There are really three things, and the firstly is predictability. We need to be able to know what is coming. We need that predictability to be able to plan successfully, to know that we can actually allow innovation into a market. The second part is a stable legislative environment, where again it's connected to allowing us to understand what is the framework that we can operate in, which lends to further predictability. And then the third one is we truly need to reward the value of innovation. And a clear indication of if that's happening or not is how much do we invest as a percentage of GDP into the health budget. And as I mentioned in my discussion earlier, I think that is a real need and a fantastic opportunity for everybody to collaborate on, to say is, at what percentage of GDP do we give Greek patients the best opportunity for a quality life? And that is really, I believe, the three things that will allow companies like J&J to remain invested in Greece and even invest more, if we have the predictability, the stability, and ultimately the rewarding of innovation.
Okay, thank you very much. I have a similar question for Mr. Gujer. What are the key elements that make a market more attractive to a multinational company like BMS to increase and broaden its business and investment footprint?
Yeah, thanks for that question. And I mean, a lot of things have been mentioned already, and we just heard about the sustainability, the predictability, which is absolutely key. But there's one point I would like to really mention here. Think about what we heard. And I mean, the slide we've seen in Mr. Dima's presentation, how is the investment in early startups in the different industry sectors? Life sciences is by far the biggest one. And we can also ask ourselves the question, we are here today and debating about challenges and the opportunity of the environment, but what ensures that in next year or the year after, or let's call it 2027 or 2030, we are not sitting together here again and we have the same discussion. So what will make the change? And I think there will be a need for a life science strategy. Because we see these pockets, these different pockets in life sciences, startups, clinical research, manufacturing, of course, commercialization. We have a big debate on a European level about IP protection and length of IP protection. We need to bring this together into a Greek life science strategy, working in partnership. It cannot be transactional. And there will be more actors because of the fourth evolution we talk about, computing power, artificial intelligence, data management. How can we bring these things together? I think this is core that really will make a difference, and in a way how we move forward.
Very interesting. Thank you. Θα πάμε και στον κύριο Tousimis. Παρόμοια ερώτηση και μπορείτε να πείτε κι εσείς, να σχολιάσετε και το θέμα των επενδύσεων. Η Amgen, ως μια πολυεθνική εταιρεία βιοτεχνολογίας, τι έχει να προσφέρει στον τομέα του εξορθολογισμού του συστήματος υγείας της χώρας?
Νομίζω ότι η Amgen μπορεί να προσφέρει αρκετά πράγματα, όπως και πολλές ακόμα πολυεθνικές εταιρείες του χώρου. Εμείς είμαστε μια εταιρεία αμιγώς βιοτεχνολογική. Ακούμε τον Πρωθυπουργό τον ίδιο να αναφέρεται στη βιοτεχνολογία σαν το πεδίο του μέλλοντος και έχουμε εμπειρία από περισσότερες από 100 χώρες ανά τον κόσμο, σε συνεργασίες με το κράτος, σε διαχείριση δεδομένων όσον αφορά στην καλύτερη αποτελεσματικότητα των φαρμάκων αλλά και τα καλύτερα αποτελέσματα για τους ασθενείς. Και είμαστε εδώ για να συνεισφέρουμε. Δεν είμαστε απλά ένας παράγοντας που δημιουργεί κόστος στο σύστημα υγείας. Είμαστε μια εταιρεία και επαναλαμβάνω όχι μόνο η Amgen, νομίζω ότι αυτό ισχύει για όλες τις εταιρείες του χώρου μας. Είμαστε εταιρείες που θέλουμε να προσφέρουμε και να βελτιώσουμε τις ζωές. Έχουμε τεχνογνωσία, έχουμε know-how και είμαστε ανοιχτοί στο να μας αξιοποιήσει το ελληνικό κράτος και η ελληνική πολιτεία.
Ευχαριστούμε πολύ. Νομίζω δεν έχω κάποια άλλη ερώτηση, αλλά και ο χρόνος μας φτάνει στο τέλος του. Ήδη είμαστε 3 λεπτά πριν. We are 3 minutes ahead. So, thank you very much, all the speakers. I think that the state has listened to you and your proposals, your ideas, which will be very important to sketch the future, to design the future of pharmaceutical industry in Greece. Thank you very much. Ευχαριστούμε πολύ.